they'll start putting olive oil, palm kernel oil. I don't know, I have something about this palm kernel oil. In today's video, we are going to be looking at management of high temperature. Any temperature more than 37.5 is an issue. So as a mother, you should have thermometer in your house. This should be handy because high temperature can come at any time of the day. And for you to establish that your baby has a high temperature, you should measure with thermometer. Thermometer is a very simple apparatus, and it's very cheap too. You can get it in any pharmacy store, and it is also easy to use. So once you check your baby's temperature and it is 37.5, the first thing that should come to your mind is expose the baby. What do I mean by exposure? Remove all the clothes the baby is putting on, or put on minimal clothes like just pants. If it is a very small baby, you can use just diapers. This is to allow the heat from the skin, from the pores, to go out from the pores. If you cover up the baby, the heat in the body can't go out from the pores because the clothing will provide more heat, cover up the pores, and the heat will not move out. Is try and rehydrate the child. Give the baby as much water as the baby can tolerate. When the body has high temperature, the tendency of dehydration is high. So try and give fluid so that the baby doesn't become dehydrated. Then there is what is called episponging. In this part of the world, most people, their first line of action when a baby has high temperature is to carry palm kernel oil and start rubbing on the baby's skin. That is counterproductive. What you should do is to clean up the skin and expose the pores. Anything you are rubbing on the skin at that point is blocking the skin pores from where the heat would have escaped to help lower the temperature. So what you should do to benefit your baby at that time is to do anything that will open up the skin pores and help heat move out. So the first thing we did was to remove the clothing. The second thing we should do to help is to tape it sponge. Use warm water and damp with towel all over the skin of the baby. Allow the water to dry. In fact, if the temperature was very high, even before you drop your towel, that water would have evaporated because the heat from the baby's body will dry it up. Do not use cold water on the baby. It will, what it does is to close up the skin pores, further increasing the temperature. So the best approach is to use warm water, which will open up the skin pores and help heat to escape. For context sake, this does not replace individual consultation. This does not replace the advice from your doctor. This is just something I feel will be handy if your baby's temperature increases at an ungodly hour of the night. These are things you should do before you have access to proper medical evaluation and individualized medical advice. So the third thing you should do is to give antipyretic. This advice should be provided on individual basis. There is a way they calculate the dose for each baby. So probably meet your doctor to give a more individualistic dose for your baby. Let me emphasize on things you should not do, because during my time working in newborn intensive care units and children's ward, there are a lot of harmful practices we see that are so detrimental to the health of our babies. One is using palm kernel oil. You will see grandma will come with the mother, the daughter, and the grandchild with palm kernel oil all over the body. You ask, what is this? They will tell you, this is how grandma wants it. I always tell them, maybe it worked in your own time, but this is no longer working in our own time, because some of them can be stubborn. You will tell them, this is not how to this is not what we use for managing temperature. They will say, is this not what we used for you and you survived and have gotten to this level? Please allow me treat my granddaughter. And at the end of the day, this complicates the issue. Another thing people do commonly is to use cold water. It might sound reasonable, but it is not scientific. It's better you use warm water, clean the body so that heat can escape. Another thing people do is to cover up the child, especially if the child is shivering. You can cover up the child for the moment if he's shivering, but once the shivering stops, the best approach should be to open up so that heat escapes. Then if convulsion sets in at any time, because the most common cause of convulsion in children is high temperature, if at any point convulsion sets in, do not put anything in the mouth. This is another very wrong practice people do. They'll start putting olive oil, palm kernel oil. I don't know, I have something about this palm kernel oil. You are complicating that issue. You are killing that baby. Because that convulsion makes the baby unconscious. So, and the baby is not in control of the swallowing reflex and all that. So once the baby is not in control of the swallowing reflex, the next thing that happens is anything that gets into the mouth enters the airway, and that leads to aspiration. And aspiration is one sure way of killing a baby. That is the major thing that kills babies with convulsion. What you should do is keep the baby on a flat surface. Do not put anything in the mouth. Then do whatever you can do to reduce the temperature at that point. All those things I've listed before. This should help you calm the temperature, and once the temperature is lowered, the convulsion should stop. And take the baby to the nearest hospital for proper medical attention, because convulsion should not be managed at home. Convulsion should not be managed at a traditional place. Convulsion should be managed in the hospital. If you got value from this video, consider subscribing, like, comment, and share our contents to your friends and family. And until I see you again, I'm not Cynthia. Thank you and bye.